Hello, good morning, good afternoon, good evening, good night to everybody. And many thanks to join today this meeting webinar. We keep admitting people, and thanks Celeste for doing so. And we will keep now, but we have to start. We have a full agenda. And I will not mention on any other thing that you have at the bottom of your screen interpretation in Spanish and French. So you can choose that for a breakout room in a session that will come later on. We will not have this, but we will explain you a little bit more details afterwards. So thanks again, and I'm handing over to the opening speaker, Robert McCouch, the Director of the Evaluation Office. Rob, over to you. Thanks.
Thanks so much, Eduard, and greetings and welcome everyone. Good morning, good afternoon, good evening. As Eduard says, my name is Robert McCouch. I'm relatively recently re-arrived Director of Evaluation here at UNICEF. I'm really delighted to welcome all of you to this webinar on the results of the corporate evaluation of UNICEF's work in strengthening civil registration and vital statistics systems, or CRVS, as most of you know it. As Eduard says, we have about 75 minutes and we want to leave ample room for discussion. So I'll keep these opening remarks fairly brief. Also, just a brief heads up, I'll stay as long as I can, but unfortunately I have a train to catch, so I'm gonna stick around for about half of the meeting, as this is a really vital topic for all of us. Let me start by saying I don't need to tell you about how important it is. Put simply, registration and vital statistics are really essential cornerstones of effective protection and service delivery. And the unprecedented technological advances we've seen over the past couple decades offer really tremendous opportunity to significantly boost these systems. At the same time, as we know, there are still very significant barriers to ensuring that these systems are in place and that they are as robust as they can be. UNICEF and its partners have been working in this space for some time now, as many of you know, and this evaluation looked at what we've been able to achieve, what we've not been able to achieve, and why. It presents findings based on a comprehensive evidence base of 10 case studies, complemented by a range of interviews. The evaluation focuses on the time frame from 2014 to 2020. And this time frame corresponds to a period of transition in the work of CRVS, in that UNICEF undertook significant work over the past decade to strengthen national systems for universal and free birth registration, as well as other areas. So the strategies UNICEF and others have employed to strengthen CRVS systems have been increasingly designed and implemented in a coordinated, multi-sectoral fashion. More and more, UNICEF hasn't gone it alone. It's engaged in building alliances to strengthen CRVS systems, both at the regional and national levels. UNICEF has also co-led a collective process with several other UN organizations to create a legal identity agenda and to coordinate the support to member states to develop a legal identity systems to register all life events, providing legal identity to all, and to translate the information into timely, reliable, and comprehensive vital statistics. So in today's discussion, you're going to hear about the detailed findings of the evaluation, but for me, the key takeaways basically are threefold. First, and on one hand, UNICEF investments have yielded results to expand the registration of births and to the overall strengthening of CRVS systems. And the contribution of these systems in leading role have been acknowledged by governments and partners. Second, and on the other hand, UNICEF can further improve its contributions by supporting governments to link and strengthen national CRVS systems with identity management systems, and by building on long-term partnerships around these objectives. And finally, adopting a holistic and intersectoral approach to design and implementation of this work. So third, this evaluation recommends broadening the scope of the organization's work. That's not something we often do in evaluations, recommend broadening the scope of work. We often recommend narrowing. In this case, it recommends broadening the scope of the organization's work to systematically support activities aimed at digitized and interoperable broad data systems, adopting adequate safeguards, data protection, and privacy standards. Really glad to see participation of colleagues from child protection and from other corners of the organization. This really contributes to making a more efficient and effective transit from the evaluation findings and recommendations to informing the strategic approach, the theory, practice, programming to strengthen CRDS systems. These are important instrumental systems to realize fundamental rights of children and to accelerate the process to attain broader development goals in the decade of action. And very finally, and on behalf of the evaluation office, I'd like to offer my thanks for the efforts made by all those who were involved in this evaluation. This includes colleagues from the program group with whom this webinar has been jointly organized. When I left UNICEF about 10 years ago, jointly organized events like this one were relatively rare. So it's really inspiring to see how we can collaborate internally to understand the quality evaluative evidence generated and its implication. Secondly, I'd like to thank colleagues from country offices, regional offices, and other divisions in headquarters. This evaluation team very much appreciated, as you'll hear from them directly, the rich discussions and engagements with UNICEF staff, implementing partners, governments, and donors in the case study countries, as well as globally. And then finally, I'd like to thank the advisory group, also known as reference group, in particular, a few individuals. So Kirsten Martino, Bhaskar Mishra, Remy Mwamba, and Claudia Kappa, all based in New York, as well as Kendra Gregson in Lacro, Cecily Modvar from Wakaro, Mirka Tulia Matila in Cote d'Ivoire. Thank you very much. You all provided really valuable information, comments, and suggestions throughout this process. And we know that the engagement in these exercises can be quite heavy at times. I hope it wasn't too heavy and it was engaging for you all. So finally, let me just say that it's my hope that this evaluation will not only help inform future programming decisions, but will also be a source of learning for UNICEF in strengthening those systems essential to the achievement of the rights of the child. I'm confident that today's discussion, not just today, actually, and today and beyond, will provide much detail and enrich our understanding of the implication of the results of this evaluation. Thanks very much. And I forgot to thank you as well, Eduard, for shepherding us in this process very much. You did a great job, and I look forward to hearing more. Back to you. Or actually, I think it might be back to Beth.
Yeah, thanks, Rob.
Yes, hi, good morning. Are you able to hear me? Okay, great, perfect. Good morning, colleagues. Yes, just to pick it up from Rob, I'm Beth Plowman, Senior Evaluation Specialist in the Evaluation Office. And I just wanted to basically open up the session for you. Great, thank you. Just to reiterate a word of thanks, as Rob has said, to our colleagues in the child protection section, as well as at country and regional office. But we also have to remember, of course, that our evaluation team was central to putting this together for us. Zoran, Dokovic, and Livingston. And I think, as they can attest, this evaluation was really an exercise in adaptation. There were some significant design changes that we needed to accommodate as we were underway. And nonetheless, we've been able to deliver what I consider to be a high quality evaluation on time. So congratulations to both the team and Eduard with the wonderful support provided by colleagues. So if I could just talk a little bit about the flow of the session this morning. So first of all, we're going to hear a bit about the objectives, primarily its key findings and its recommendations. Following that, we'll have a brief period for questions and answers from our colleagues who are joining us online here this morning. After that, we're going to shift a bit, and colleagues from child protection, primarily Kirsten and Bhaskar, will lead us through some considerations of some of the actions that might actually result from this evaluation. And we would really like you as participants here to help us to consider the relevance and applicability of these recommendations to your settings. And so we'll have an opportunity to break into two small groups for a few moments and to have those discussions. Finally, we'll reconvene, we'll share observations from those groups, and then we will close the session. So I welcome you all, looking forward to a really stimulating discussion this morning. And from there, I will turn it back over to Eduard. Thank you all.
Thank you very much, Beth. I'm not gonna do any other thing, but just insist reminding that you have interpretation available into French and Spanish. Just click at the bottom of the screen and select the language that you prefer. So I'm handing over to Zoran and Anne to give us the presentation on the evaluation. Zoran, over to you.
Thank you very much, Eduard. I'm really pleased to have this opportunity to address distinguished colleagues from UNICEF to present the results of our work that is summarized in the evaluation report, which I'm sure you had the chance to take a look in preparations for this meeting. So this presentation will be delivered by myself, Zoran Dokovic, as a member of the evaluation team, and my colleague Anne Livingston, who is joining us also to cover some of the aspects of the evaluation report. So I would like to start with evaluation objectives. When the evaluation was originally put together, it was put together with three objectives in mind. The first objective was to determine the relevance, coherence, and innovation of UNICEF programming on civil registration and vital statistics system strengthening from 2014 to 2020, pre-COVID-19 programming, in fact. And then the second objective was to examine the effectiveness and contribution of UNICEF programming to birth registration in selected regions and countries. And finally, to provide well-evidenced findings and recommendations regarding UNICEF leadership and advocacy, strategies and methodologies for strengthening of national regional capacity and mechanisms to strengthen civil registration and vital statistics systems. So with these objectives in mind, evaluation governance was established, as you have the opportunity to see here on the screen, on the slide. People in driving seat were the UNICEF Evaluation Office and Management, and Eduard and our colleague Mariel, who is not today for this presentation, but then the evaluation office guided our work of the evaluation team, myself and Livingston, and a third member who was with us for a certain period of time, Vasu Anandan. And we also have the, we benefited from expertise of an external consultant who guided us on some key aspects throughout the work. And finally, there was the evaluation reference group, which whose members have been mentioned earlier during the introduction, and they also provide in the critical milestone moments of this evaluation process their critical insight and support so that this process is successfully brought to the end. So the evaluation is based on evaluation questions and the goal to answer these evaluation questions, and they relate to relevance, effectiveness, coherence, and innovation. So in terms of relevance, the idea was to see, can we move on to the next slide, please? Yes. In terms of evaluation criteria and understanding the relevance, the idea was to see to what extent UNICEF demonstrates responsiveness to the needs of rights holders and duty bearers, understands concepts and adapts as needed to changing context and conditions. In the context of effectiveness, our aim was to gauge to what extent UNICEF makes unique, identifiable contributions to stronger CRVS systems, and in particular birth registration, and does so in a manner focused on vulnerable and excluded groups. In the context of understanding the coherence of UNICEF programming on CRVS, strengthening our idea was to see to what extent UNICEF engages in strategic partnerships around CRVS, and to what extent UNICEF works effectively with partners through coordination and synergized implementation. And finally, in the area of innovation, we wanted to see how UNICEF introduces and uses new hardware, digital capacities, and soft approaches to enhance its contribution to CRVS system strengthening and legal identity management, and positions the same for uptake. Next slide, please. Throughout the evaluation, we applied the approach that builds around contribution analysis model. And here on the slide, you can see how it works in the practice. So we already mentioned the key questions that we were asking to ourselves. And that is, for example, as presented here, to what extent has UNICEF made unique and identifiable contributions to national systems, and in turn increased ratio of birth registrations? To answer these questions, we applied the approach of understanding what was the contribution of UNICEF in the process of making this change, and that is the what was the intervention logic of national authorities, and what was the intervention logic of the UNICEF in supporting national authorities in increasing ratio of birth registration in this particular case. So to achieve that, we have developed a detailed theory of change and intervention logic of both of UNICEF and national authorities. And on the basis of these intervention logics, we have conducted the analysis of the actual work done by national authorities, and to what extent UNICEF has been able to support the authorities in implementing that intervention logic. So our analysis focused on case studies of 10 countries that was already mentioned earlier. And we further to that, we also complemented the analysis with a range of interviews with relevant stakeholders in these countries. And then we cross-linked the entire data to understand to what extent UNICEF has been instrumental in contributing to the changes in a particular area that we are looking at. So this is a very complex matter. This is in short trying to understand the approach that we had in mind when applying the entire evaluation process. Next slide, please. Yes, as I mentioned just a little while ago, in order to understand the UNICEF contribution, we also had to understand what was the UNICEF position in the context of support of CRVS systems, and where is UNICEF programming centered in the context of strengthening of these CRVS systems. So we analyzed the past information, and we also analyzed international standards and understanding, relevant understanding in terms of what civil registration and vital statistics system represents. So we started from the United Nations Statistics Division overview of how civil registration and vital statistics systems looks like, which is represented by vital events that are being registered, informants that inform on these events that have occurred, relevant registration authorities, and how that information is shared for the production of vital statistics. And as you can see in this image, we highlighted in blue the areas where UNICEF concentrated its effort through programming to strengthen civil registration vital statistics systems. In this UNICEF blue color, as I called it, we see strong footprint of UNICEF in strengthening of these systems, whereas in the lighter blue colors, we see some degree of intervention of UNICEF, however, not to the extent as it has been the case with Beth. And in fact, this highlights the understanding that all the efforts of UNICEF have been mainly directed in strengthening birth registration vital event. Then we understand the large position of CRVS systems in the context of national legal identity systems. We realize that CRVS systems also play a very important role in the context of identity management through linking civil registration data with there has been a cut. I don't know if you could hear all of it. I'm back online again.
Yes, now, yes, we can hear you. There were a couple of seconds you were out.
Thank you so much. Basically, there is a broader position of CRVS systems in the context of national legal identity systems that involve also population registers where these are being run, also identity management systems, and the range of functional registers. And with that in mind, we ventured together with our colleagues to put together a detailed theory of change for UNICEF interventions in this area. And for that, I switch over to my colleague Anne for further presentation.
Thank you, Zoran. Hi, everyone. Thank you so much for participating in the webinar. We're thrilled to present our findings and to later lean on to an interesting discussion. As Eduard, if you can change slides, please. So here we have UNICEF's intervention logic for birth registration and CRVS system strengthening, and Zoran spoke a little bit about this, and that intervention logic guided our analysis. So what does it show? This intervention logic shows links between the inputs, the activities of UNICEF and CRVS, and the results of UNICEF's work in that area of CRVS. And this intervention logic was developed on a global scope, but also for country cases, as Zoran also mentioned. What purpose did it serve in our evaluation? So the evaluation used this reconstructed intervention logic to ensure that the evaluation questions, which are based on the evaluation criteria, when answered, would serve to validate the key links identified in the program logic. And based on the observed results, the evaluation focused on why and how the results were achieved, whether UNICEF supported efforts had influenced or made an important contribution to the observed results. If you look at the intervention logic, you find in the first column the intervention domains. There are 5 of them, and they are based on the Password to Protection reference document that we've used at length during the evaluation. Then you have UNICEF's activities and investments, and those were mapped out during our research. Then you have the assumption. The assumptions are based on the evaluation criteria on those questions that we aim to answer. And this all led to the outputs and the outcomes at country level for the results. If you can move to next slide, please. So in terms of data collected and used, as you can see, there's a list of the 11, what originally was the 11 countries, and we ended up using 10 countries for the case studies and the key informants. Myanmar was left out for country context purposes. So we built 10 case countries and had key informant interviews from these 10 countries. And then to your right, there's a breakdown of the key informant interviews and how that was broken down between female and male, and in terms of what were the nature of the participants. And we can see that 47% of people that were interviewed were from UNICEF, and then we had a significant portion from the national governments, as well as other entities such as development partners, implementing partners, and CSOs. And then on the online survey, we had a 50% response rate from 28 different countries. And again, with a breakdown between male and female and the nature of the different participants. So now that we've done an overview on kind of the context of this evaluation, we'll be able to move on to the findings. So next slide, please. The findings are split between, according to the different criteria, evaluation criteria for them, and they're all linked to specific question that we aim to answer. For the relevance criteria, what we looked at is, what we aim to answer the question was, to what extent does UNICEF respond and adapt to the needs of stakeholders and include strategies to ensure that vulnerable or excluded groups are not left behind? And in the cases where UNICEF did adapt, how was that done? And what were the barriers and the facilitators? So here our focus in our research and in this evaluation was really looking at the ability of UNICEF's ability to respond and adapt to the needs, and as well, when it did do that, how did it do it, and were there facilitators that impacted the result, or were there barriers that were an obstacle to these activities? And we found 3 findings. Finding number 1, UNICEF intervention have been broadly aligned with national CRVS priorities. So what we found out is that government's priority to usually UNICEF supported the national governments in their priority to strengthen CRVS systems. So there's been an alignment of UNICEF's activities and the national CRVS priorities. For finding number 2, where government CRVS strengthening priorities have been broader than efforts to address birth registration rates, UNICEF does not appear to have prioritized support to such intervention. On this one, we can see that UNICEF's did not always fully adapt to the need of stakeholders when it came to strengthening other components of CRVS system apart from birth registration. So there was a strong focus, understandably so, on birth registration, but not so much on other components of CRVS system strengthening. For finding number 3, UNICEF has adequately responded to special circumstances, adapting its strategies. This one is obviously pretty straightforward, considering the situation or the impact of COVID on the different on UNICEF's activities. And what we found out is that UNICEF did adapt strategies when it came to the health pandemic, but also to other contexts such as conflict or natural disasters. And UNICEF was able to shift its programmatic approach and provide humanitarian relief or help governments to keep their civil registration services running during the pandemic or during conflict. And these, there's a couple examples, for example, in Mali with the jihadi groups, or in Indonesia with earthquakes, where UNICEF's activity was able to address that. Next slide, please. Now, the second criteria was the effectiveness. And on the effectiveness, we tried to answer 3 questions. The first question is, to what extent and how has UNICEF support strengthened CRVS systems, institution, and capacities? And has it done so in a manner that will be or has been sustained over time? So here really focus on the sustainability of the activities and how UNICEF support help on a broader level, system, institutions, and national capacities. And we have 4 findings under this group. Finding number 4, UNICEF demonstrated leadership in supporting governments to reinforce the enabling environment for CRVS, although there have been important challenges to make sustainable the increasing capacity to deliver CRVS services. So what we found out is that UNICEF has had a leadership role and is recognized by national governments and development partners as a leading agency in supporting governments to improve their CRVS systems towards increasing birth registration rates. So this has been a positive impact, and of course there remains some challenges for the sustainability of the system strengthening. Finding number 5, UNICEF has increasingly reinforced interoperability between CRVS, health services, social services, and identity management. This is something that was spoken a bit earlier about the importance of interoperability between different systems, in particular between the CRVS and the health services. And this is something across the observed, or during the observed period, this interoperability between different systems to increase birth registration rates has proven to really impact positively the birth registration rates. Finding number 6, UNICEF has missed out some opportunities to leverage large CRVS investments undertaken by government and development partners. So here we saw that, in some cases with large CRVS investments undertaken by government or development partners, and these were frequently related to ICT systems, UNICEF's contribution was limited to supporting the development of digitized solutions for communicating birth or death notifications from local communities and health facilities, but did not always get involved in the broader picture of that large investment. And so here they might have been some missed out opportunities and as an area for improvement. Finding number 7, national stakeholders perceive UNICEF's contribution as essential for birth registration, while UNICEF introduced strategies to transfer the program ownership. So we've seen that there is a link, a relationship between the perception of UNICEF as essential to improving birth registration rates and the government ownership, the national government ownership of CRVS matters. And what came out of it is that in cases where there is very little government ownership of CRVS matters, UNICEF was perceived as essential. And on the other hand, in cases where there was a government ownership of CRVS matters, then the perception of UNICEF was being seen as moderate. And so this was an interesting finding to see how important and essential government ownership of these CRVS and birth registration is essential, and what is the correlation between the perception that governments might have in terms of UNICEF's implication in that matter. If you can change slides, please. Okay, still so on the criteria of effectiveness, we have a third sub-question, in which we try to answer, how did UNICEF's intervention at country level contribute to those results? And how did internal and external factors influence, whether positively or negatively, the achievement of these results? Here, what we focused on was really the nature of UNICEF's activities. What happened? What did UNICEF do to be able to contribute to these results? And we have 4 findings. Finding number 8, UNICEF supported governments to reform policy and legal frameworks in line with international standards. So here we saw that in many cases, UNICEF helped and supported the government in passing new legislation regarding CRVS matters or in advocating for policy and reforms. And so this has been a big support from UNICEF's sides to national governments. Finding number 9, UNICEF supported governments to improve supply and demand of birth registration services, despite some bottleneck limiting the achievements. Here again, we saw that UNICEF was very active in helping governments improve the supply, bring the services closer to the population, particularly to the hard to reach populations in terms of registering the birth or vital events. And that usually came in association with actually increasing the demand for birth registration services, such as activities that included raising awareness or working with local communities to raise awareness on the importance of birth registrations. Finding number 10, UNICEF supported birth registration strategies with limited support given to other vital events. So of course, UNICEF is very focused on birth registration, and understandably so. But what we've seen is that in some countries, there also have been initiatives to increase marriage registration, death registration. And in these instances, we've seen that although UNICEF is active in the registration of these other vital events, they've been limited. Their role has been pretty limited, and there's room for improvement in these other vital events. Finding number 11, regional CRVS initiatives supported by UNICEF have had a major positive effect in generating political commitment. So here, UNICEF strategically supported the development of regional CRVS strengthening platforms across the different regions with the view to generating a multilateral commitment to increasing registration rates. So this has been a positive contribution. Next slide, please. And then the fourth question, or the third question under the effectiveness criteria, is to what extent do national programs supported by UNICEF achieve results for children of different backgrounds and abilities, especially those considered particularly vulnerable? Our focus for this question was to look at and evaluate the activities targeting vulnerable or excluded populations or excluded groups. Finding number 12, UNICEF developed tailored strategies implemented with local partners to identify and refer vulnerable children for registration. The results here, the finding was that indeed UNICEF worked with local actors, local community, religious leaders, community leaders to be able to identify fairly rapidly and refer those vulnerable groups for registration. So there was a good collaboration with different entities to be able to identify the vulnerable categories of children. And then finding 13, the use of bottleneck analysis by UNICEF has enabled the identification of gaps and generated political commitment. Indeed, we've noticed that in the cases where there has been a bottleneck analysis that was conducted, the identification of the gaps were done a lot easier, and the effectiveness of the strategies were even more positive because the gaps had been identified in terms of registration or the lack of registration. Finding 14, while recognizing that birth registration better protects vulnerable children, UNICEF has not taken a systematic approach to birth registration as an enabler in the realization of children's rights. So in this case, we, of course, many children, around the world face multiple deprivation and on a daily basis, and they may have been alleviated in part through birth registration. And what we've seen here is that UNICEF does not seem to have systematically taken the approach or adjusted its programmatic approach to incorporate birth registration for certain situation of vulnerability. And rather, it has worked more on a case-by-case basis. Next slide, please. So here we have the two remaining evaluation criteria, coherence and innovation. Coherence, we aim to answer this question: how well does UNICEF use collaboration and partnerships to strengthen CRVS systems? And the finding that came out is that UNICEF does leverage or did leverage cooperation with partners and has promoted public and private partnerships to increase impact of interventions, and that it's used, cooperation and collaboration with national and international development partners to be able to increase its impact. So that's a positive effect. And innovation, how well does UNICEF use its mandate and resources to ensure that the rights of children underpin technological advances and policy innovation in the areas of CRVS and legal identity? Found two findings, and finding number 16 is that UNICEF did foster innovation, including the use of innovative technology for reporting birth and other vital events. And this was particularly important and crucial for the registration of hard to reach populations or in hard to reach areas. And then finding number 17, which kind of comes in and balances the previous finding, is that challenges around the operating context and design of innovative initiatives have limited their ability to achieve results and be sustained over time. So while there has been some innovation, and while UNICEF has fostered the use of innovative technology, there's been an enabling environment that we can't forget. And for these innovative solutions to be able to work and to be efficient and sustain over time, there needs to be an environment that is able to work with these innovative, and I'm thinking of legislation such as data privacy or equipment or capacity to be able to sustain these new innovative solutions in the country. So it's very country specific, but there's an environment that we need to think about. So this wraps up the 17 findings. This evaluation was very rich in terms of what we're able to find, and this leads us to the recommendation that Zoran will now go and present.
Thank you very much, Anne. As for the recommendations, I will briefly highlight what are the recommendations from this evaluation. And I'm certain that you will have a chance to read in the evaluation report a thorough elaboration on each of these recommendations, and that you will also have the opportunity in the rest of the discussions to come back to these recommendations and to discuss what is the meaning and the rationale behind these recommendations. I just want to say that the recommendations, 7 of the recommendations in this evaluation report are firmly grounded in the findings and the conclusions of the recommendations. Elaboration of each of these you can see at the greater detail in the report itself. So the recommendation 1 highlights that UNICEF activities around CRVS system strengthening should be established as an integrated and intersectoral component in countries requiring large-scale interventions. System strengthening policies, technical products, and interventions in general should be based on a sustainable business model, including funding. So really the key words are integrated and intersectoral component. And finally, focus on building sustained business model, including funding for this business model. Recommendation 2 underscores that UNICEF should promote the systemic and periodic assessment of birth registration bottlenecks and barriers by relevant national authorities, especially in countries with high level of birth registration. UNICEF should also advocate with and support national authorities to prioritize actions to overcome these barriers. These measures should help address in a more permanent and systemic manner the protracted marginalization of certain categories of children. Really the key words is bottlenecks and barriers, and countries with high level of birth registration, where we wanted to underscore with this recommendation that interventions in CRVS is not only about the countries where the CRVS systems are weak. In the countries where CRVS systems appears to be well developed, there is a high level of protracted marginalization of certain categories of children, precisely for the reasons that they are not registered in the CRVS system. Next slide. Recommendation 3 highlights that UNICEF should leverage and promote the central role that birth registration, CRVS, and legal identity systems hold in public administration systems to advance towards universal birth registration. This implies engaging in the establishment of digitized and interoperable central repositories with adequate data protection safeguards and aligned with other administrative government systems. This recommendation obviously highlights the major shifts in digitization of these services that are also becoming interoperable with other government systems, obviously with all data protection safeguards in place. Recommendation 4 highlights that UNICEF should systematically share experiences from country offices that created and adopted digital platforms to expand registration services to hard-to-reach communities and promote the use of such knowledge to inform replication in different contexts. UNICEF should promote and assist the standardization of digital platforms and interoperability with existing digital health systems, including birth and death registration, as well as other vital events. So this is another recommendation that goes further into how to address the issue of digitization of CRVS systems. Next slide, please. Recommendation 5, in countries where birth registration is readily and freely available, UNICEF should critically examine the comparative effectiveness of strategies to expand registration and assess particularly incentive schemes that may serve as an indirect means to increase birth registration. For details, I refer you to the report, but I would only highlight incentive schemes as an important aspect of addressing birth registration rates increase. Recommendation 6, UNICEF should develop and engage in joint assistance projects to CRVS strengthening with UN legal identity agenda partners, and should actively discourage siloed approach. Given the multi-layer and complex nature of programming for CRVS improvement, cooperation should also be sought with international development partners, including aid partners, civil society, and the private sector for sustainable investments. And the last recommendation is that UNICEF guidance to country offices should be updated to reflect the changing context of CRVS system strengthening within public administration and to integrate more holistic approach to CRVS strengthening in coordination with the United Nations and non-United Nations development partners. And with this, I conclude the overview of the recommendations and also our presentation of the evaluation report. And now I direct you to the upcoming poll that will show up on your screen, which will list all the recommendations. And it is my understanding that the poll will be asking you to rank the recommendations in terms of their relevance for the work in your offices. Thank you very much. And I hand it back to Eduard. Yeah.
Thanks, Zoran. So just launching the poll right now that you should see in your screens. We're going to have 1 minute. So you will see the rewarded recommendations and you are asked to pick the 3 most relevant recommendations in your country context. Okay, so I think half of you have answered. Okay, a lot of people is answering still. I'm giving 10 seconds more. Perfect. So thank you very much for answering the poll. We are keeping the results for a moment in the drawer, and we'll hand them over to child protection colleagues, to Kirsten and Bhaskar, and at the end of the discussion, we'll share them and comment. So thanks much, Zoran and Anne, for a very well done presentation. What we have now is we just wanted to share with you. Most of you, if not all, are familiar with the management response coming following evaluations in UNICEF according to our policy. Well, what you see now is just a quick reminder. I'm not going to spend time on this, but basically there is a following an evaluation. There is a system to help informing decision making and ensuring that actions are taken on the basis of an evaluation that tells us that we have to trigger this management response, and then the program leads the clients of the evaluations are leading this management response. In this case is child protection, the program group, child protection in HQ, with Cornelius Williams formally in the head, and then Kirsten and Bhaskar moving the process. And normally in this case, it's 2 months after the release of the report that the management response process has to be released, made public. So, and in this occasion, in this meeting, this webinar, this is going to help informing, refining this management response process, particularly through the discussion that we're going to have now. So I wanted to, before we move to the next part of the meeting, the discussion that will be led by child protection colleagues, we wanted to open a 10 minutes questions and answers session now, following Zoran and Anne's presentation. In the discussion that is following, we're going to focus on the recommendations and the so what, no, and with the recommendations. So if you want to have some questions about that, I would ask you just to post questions about clarifications, no, things that are ambiguous, that are not properly developed in the presentation, or that you cannot find in the brief or in the report themselves, no. So for now, we have two questions that we would like to address. The first one from Esther, she wrote it in the chat, Esther Cagua. So in terms of the finding on improving supply and demand, did the team find that UNICEF contributed to improving completeness and quality? Also, was an estimate on the proportion of births registered before and after UNICEF's contribution? I think I would pass it over. I would ask Zoran if you can comment on this one.
Thank you, Eduard. Yes, I have to say that in terms of the methodology that was applied for this evaluation, as you could see also in the report, it was obvious that we have focused on 10 countries. So in those 10 countries, we indeed saw the evidence of increased birth registration rates in all of these in all of these countries. Not only the birth registration rates, but we also looked the equity spectrum, rural, urban areas, well-off families, a lot less well-off poor families. What were the changes? What was the dynamics in the increase in birth registration rates? Whether some have been advantaged with the policies applied by the states and that UNICEF supported, whether some equity groups were particularly disadvantaged. And that was really the focus of our investigation, because overall we saw some increase, but that increase was not necessarily consistent across different equity groups. Again, I refer to the point that we looked in detail only into 10 countries, so we cannot really speak about global aspect. I would also say that something that we have identified, that in the countries that on the surface, when you look at the statistics, they do not appear to have an issue with registration rates, and that the registration rates by all means would be already considered as high registration rates. I refer back to one of the recommendations that we've had in the report, and that is that we see a highest level of marginalization of children, in particular, precisely in those countries where rates are pretty high, and there is very little attention to CRVS, and there is an understanding in general public that this problem has been solved, that the rates are okay. However, even if the rates are really low, like 5% of closing gap last mile, as we refer to it in the report, depending on the country, in nominal numbers, these could be huge numbers, from 10,000 to hundreds of thousands, depending on the size of the population of the country, which prompted us to pay special attention to highlight that when it comes to registration rates, overall figures are really important, but it is equally important to look at the individual, because even in the last few percentages that are missing, that is the last mile to cross, some severe marginalization and abuse of children's rights can be identified. So this is what I would have to share on this occasion on that particular topic. Thanks.
Thanks, Zoran. I think you covered, you tapped a little bit on part of the answer to the next question. Is the question posed by John Levy. I'm going to go a little bit fast, not to eat much of the time for the coming session. So if I interpret it correctly, Jean, your question is about, so what do we have to say about the work of UNICEF on CRBS and the connection with the child rights element, no? That the fact that the legal identity is a right enshrined in the CRC. So I think this has been covered and in the evaluation definitely, and it's been also mentioned now in the presentation. I would refer to one for an answer if you wish, but basically just if we can tap on I think in the connection of the findings, and particularly the finding number 14.
Yes. And I thank you, Jean, for this question. And I think, I mean, if I understand correctly, you're referring to legal identity being a children's right. And yes, you're right. And we're going with this, obviously, this understanding that you know, the right to birth registration, right to legal identity is a fundamental right, and that is reflected in the intervention logic. If you see the intervention logic, where, you know, looking at the activities, the outputs, and then also the results at country level, but also the results in terms of the realization of children's rights. So this is definitely our aim, and so this has been addressed, you know, more in depth in the report. And now on the specific finding, on finding 14, I think, is about, you know, while UNICEF does recognize undoubtedly that it's a human right and a children's right, sometimes it hasn't been able to take in a systematic way to take that approach of birth registration as being the first right and an enabler to realizing other rights of children. And so it's in that sense that you know, there needs to be an improvement to be able to systematically consider birthright as an enabler to other rights that are as, you know, or that, you know, as important for children as well. I hope this clarifies a little bit your question.
Thanks, Anne. Yeah, I see Jean replied. Also, thank you. And we have barely no time, but just want to comment on from Piyush Anthony. He said priority should be given to demonstrating models of how birth registration can be integrated with population register and interoperability with social protection system. This is definitely covered in the evaluation, and it's part of one of the recommendations. So I think this is very well addressed. And then higher great work and presentation. Was availability of registration rate estimates a criteria for country selection? If so, do you think that could have had implications, and were these controlled accounted? So yeah, let me comment on this one quickly here. We barely have time, but thanks for the question. Yes, definitely, it was a criteria for the selection of the countries, one of the several mentioned also in the report. Now, I don't understand if this was controlled, or if the implications were controlled. I probably imagine that you refer to the quality of data or to the reliability of the data, but in some cases, well, in all the cases, the team explored the possibility of using additional sources of data, particularly administrative data. Although this was a rare case, it happened, if I'm not wrong, in a couple of countries that could complement, this information could complement actually the data from surveys, from population surveys, mostly basically mixed and DHS. But yeah, I hope that that you mean you refer to this, and that I answered. Otherwise, we can talk bilaterally about this. So I would like to move forward. Thanks that we cannot take much time now on this, but otherwise we're gonna eat too much of the time on the discussion for that is coming. So I would like now to pass it over to Kirsten and Bhaskar. So to take the lead on the next session on the guided questions, no? Guided discussion. Over to you, Kirsten. Bhaskar.
Yes, thank you so much, Eduard. I hope you can hear me and see me. I hope, I don't know. So we're now going to break up into the guided, well, the discussions of the working groups. We will have two working groups, one facilitated by myself with support, of course, from Eduard, and the other one facilitated by Bhaskar with support from Celeste. You will be automatically redirected into your working group. In case you do need interpreters, please note that the interpreters are only available in group 1. So if you do need that, they will be able able to redirect you into group 1 so that you can follow the discussions. So essentially, we will be looking at all the recommendations. In group 1, we will look at recommendations 1, 2, 3, and in group 2, the 4, 5, 6 recommendations. And we will be basically responding to the following questions with regard to each recommendation. What we would like to know from you is how relevant is this particular recommendation to your country, region, and context, and why? And secondly, how would you propose to align your country program implementation and strategies, etc., to these recommendations? What measures are needed and who are the key actors? What is a reasonable time to act upon these recommendations? I know it's quite a lot, but I hope we can get through quite a bit. We will be asking somebody to volunteer as a rapporteur to feedback very briefly and summarize some of the discussions in the plenary after the working group session. So I think we're ready to go, right, Eduard, into the breakout rooms?
Okay, I think we have in the plenary, Kirsten, we have, sorry, Bhaskar, you're here.
Group number 2.
Okay. Okay, just we have, yeah, we should have everybody here. Do you have the access to the screen? Can you see the screen? But you're muted.
I can see, but the option is, give me a second, only room number 1.
Well, let me check. Let me change with Celeste. Celeste will accompany you 1 second. Okay. Let me see that Celeste comes here. Okay. Celeste, are you here with Bhaskar now?
I'm back here.
Perfect, excellent.
Okay.
So then I'm going to move the interpreters to the other room, and can you take care of showing the screen?
Yes. And I think they need you to share the presentation in the other room.
Yeah.
Okay.
So I don't know where I'm in, room number 1 or room number 2. Now.
Bhaskar, we're in 2.
All
Yeah.
right. Okay. So, all right, colleagues. Good morning, good afternoon, good evening, depending upon where you are. So we have three recommendations. Recommendation number 4, 5, and 6, and we have about 20 minutes to discuss. And so what I will do, I will quickly take you through these recommendations, and then maybe we can spend about 5 to 6 minutes discussing each recommendation, keeping the 2 questions that Kirsten highlighted. We have to answer these 2 questions for each recommendation, and I would also request that we have to appoint a rapporteur who can provide a 2-minute summary of the discussion during the plenary. So is there anyone who can volunteer? Or I can pick someone. Let me go through the names. Sonia, can you do it, please? Hello? All right, let me start with, let me start with these recommendations, and we can come to this. So recommendation 4 is about synchronizing UNICEF supported digital platforms and promoting and assisting standardization of digital products and interoperability with existing digital health systems such as DHIS2. And can you go to next slide, Celeste? Recommendation number 5. Recommendation number 5 is about looking for strategic strategies, including utilizing existing incentive schemes such as cash transfer programs of social sectors, maternity-linked programs, etc. We have some good examples coming from Nepal and India. And can we go to recommendation number 6? Next slide, please. Recommendation 6 is about working with other UN agencies to work on a wider CRBS agenda, focusing on birth registration, death registration, vital statistics, establishing interoperability with other sectors, especially health and national ID, and also engaging with civil society and private sector for sustainable investment. Most of you would know, but nevertheless, let me say that UNICEF co-chairs UN task force along with UNDESA and UNDP. So now we can go to recommendation number 4 and start our discussion. I open the floor, but please, somebody will have to report. Thanks. Any comments? Anyone wants to come in, please? Celeste, can you go back to slide number 22 so that they can look at the questions again? So these are the questions, 2 questions. No hand, I don't see any hand. Please unmute yourself and just chip in. Oh.
Hi, this is Anne, the evaluator. I'm not going to try to answer this, but I could just provide a little bit more detail to that if you know if that can get the conversation going. But the question is how relevant there is the recommendation to your country and region context, and why. This is an important one because we found that obviously during our evaluation, country context was obviously specific by nature, but also that kind of shown, you know, the different activities that have been working, you know, better in some contexts than others in terms of birth registration, and also, you know, this kind of affects or impacts the recommendation because you know the recommendation might shift depending on your specific country context or the region, and might become, you know, more important or might need to be, you know, tweaked a little bit. So hence the importance to get your feedback on this.
Thanks, Anna. I know like this is very useful. Colleagues, please come in. Your feedback is very, very important.
Perhaps if not, you know, answering if this question is the question number 2 is, you know, pretty broad and a big undertaking, perhaps we could start by, you know, seeing who are the key actors in the country program implementation strategies, and you know what measures are needed. Maybe we could start with 2A if anybody wants to give it a shot.
Even if you have any general comments about these 3 recommendations, please feel free. No one, looks like every. All right. In that case, can you go to slide number 26? You know, like maybe I can describe something that might invite some discussion. Is there any country where you have supported digitization of birth registration notification, or have you done anything in terms of coming up with digital solutions that has really helped on the ground? Anyone? because here the idea is to come out of this mindset of silos and bespoke solutions. We have to align our product so that it can be scaled up throughout. Now, that is the understanding of this recommendation. I know, like mobile notification system, mobile phones are being used, like for data capturing in many countries, Tanzania, Ghana, and others. I don't see anyone coming forward. Celeste, can you go to next slide? This is about utilizing existing incentive schemes. Nepal is a good example. Nepal is one country. If you look at the latest report, the birth registration rate for poorest quintile is higher than the richest quintile, and this precisely happened because of cash incentives linked schemes.
And in the evaluation that we did, we found that actually Nepal was one of the only or the few countries where they had such an incentive scheme of social protection, and that it worked really well. So this is not something that was predominant in the case studies, and so hence the importance because it's it's a minority, but it has produced very good results. So it'd be interesting to see if in your cases you have any experience on incentive schemes of social protection that that ended up being a powerful instrument for increasing birth registration, if you've had experience with that.
We agree, but like this gas linked schemes are a good way to cover the last mile, especially when we are stuck at 80-85%. Like it can always help us to reach children who are vulnerable and generally who cannot be reached through the routine ways. There is another example, even in India, like Janni Suraksha Yojana, which is the maternity benefit scheme. Birth registration has also been included as one of the milestones before funds are released. Celeste, can we go to the last slide? Recommendation number 6. So here, this is a very important recommendation. The idea is, because we have been focusing a lot on birth registration, doing great work, but now it's time to widen our lens. So we have to focus on birth registration, death registration, vital statistics, integration with other sectors. So it has to be a all-encompassing kind of, and from UNICEF side, most of you know that now we have an outcome indicator to assess the extent of interoperability between health and CRVS. And we are working on a child protection health joint statement, and that will be released later this month. And of course, the idea is to have a holistic approach as recommended by UNLEA, and we have to work with other partners like UNFPA when it comes to vital statistics, and WHO and other partners when it comes to death registration, including causes of death. And we have some excellent examples of working with private sector and with civil society so that this model becomes sustainable. And would you like to add something? Because I don't see anyone.
Yeah, thank you. What we saw during the observed evaluation and during the observed period of the evaluation is that there was, a solid approach to birth registration, CRVS, even within UNICEF's different sections. And so we've seen some UNICEF activities within child protection that weren't joined with the health sector, for example, and we've been able to see missed opportunities in that case. And so this recommendation stems from the fact that even within UNICEF's mandate, there's been different sections that have been pretty siloed, and then also with different UN agencies. And so there's really a need to bring these different sections and entities together and to look at not in a silo way, but look at not only birth registration but other components of civil registration along with different partners to really group them together in order to produce the most efficient results.
So thank you. I don't know how much time is left. Celeste, do you have any idea?
I'm sorry?
Do we have, like when we have to go back to the
Yeah,
plenary?
I'm chatting with Eduard right now as to when their session will end so that we can all go back to the panel. I think they're still discussing. Let me reach out to him.
We're still discussing. So we have, why not utilize this time?
Okay, we have 3 minutes left.
We have 3 minutes left.
And then we'll go back to the plenary.
I see Lucy, I see Monica, I see Richard, Sonia. Stanley, Tida, Violeta, anyone for your final comments, any observations? Oh, sorry, Sonia is one of the interpreted, sorry.
So perhaps we can do the summary.
I think because all these 3 recommendations are very valid, and you'll see that both in terms of urgency and impact, they are very high, they rank very high, and we have to follow this UNLI approach. We need to come out of this mindset of having bespoke digital solutions, specific to one country. Now it's time. We are working on it. There is some good news that as part of 7% Innovation Fund, UNICEF is working on coming up with a digital CRVS solution that is going to be implemented in 3 countries, Indonesia, Nigeria, and Nepal. And after that, it will be offered to other countries also for scaling up. So a lot is happening, but still, we have to tighten our strings, and because going forward, we are already in the decade of action, and next 3-4 years are very, very crucial to have numbers both on birth registration as well as death registration, and COVID-19 has clearly highlighted the need for having a well-functioning death registration, and by corollary with the birth registration system. So both birth and death registration have to go side by side. They are 2 sides of the same coin. And then another area, vital statistics. So far, we have been getting data from surveys, DHS and mix, mostly for under 5s. Now it's time we should start focusing on under 1s, because that is what is needed for real-time tracking. We'll have more opportunities to discuss on this. And do you have any final comments, final observations before we go to the plenary? No,
I think, I hope these findings and recommendations were well received, and perhaps the silent means that, they're great recommendations and should be implemented right away. And I hope that's the case. But as you say, I think these are very valid, and they're really, will help push the CRVS agenda forward in terms of improving, not only birth registration rates, but, the entire CRVS ecosystem that's surrounded. And I think that's pretty important.
All right, then, then we can go back to the plenary. Or maybe we can go a bit earlier to see what is being discussed in that group so that we can also get benefited. Celeste, is that okay?
Yes. Yes, I believe. Eduard says he's also moving everybody in 1 minute.
Okay, perfect.
The poll, if we can show that. before we move to the summary, 1 second. Can you see the results in your screen?
Yeah, we can.
Okay, if you want to comment briefly in 1 minute, Bhaskar.
All right. So in terms of ranking, recommendation number 1, which is about establishing integrated intersectoral system, like number 1 with 72%. Then for rank 2, we have a tie. In fact, there are 3 with 50% each. That is recommendation number 3, 4, and 6. And the third position goes to recommendation number 2 with 40%.
I was having a discussion over the chat in our group with Hrayer on basically he was suggesting the interconnectedness between recommendation 1 and 3. There are other ones that are overlapping a little bit and that are interconnected. But yeah, there is a little bit, it makes sense, basically, this overall result. So over to you. Maybe we start with Kirsten with the group 1.
Okay, thanks, Eduard. Very quick wrap up. Regarding the first recommendation, it's all the members agreed that it's highly relevant. It needs to be elevated cross-sectorally so that we can leverage the advantages of other sectors. And when it comes to second recommendation, it's a very self-endorsing one. It's the most important one. And the example from Bangladesh was very relevant. From 3% to 96%, Bangladesh moved in a quick manner because birth registration was linked to 15 social protection or basic services. And that demand side focus help birth registration to move up faster. And in terms of saying that why how a business model will help, the example from India was drawn where any estimation of birth cohort is still based on crude birth rate. And this is one point that we can highlight, saying that how CRVS system can help the health sector and other sectors in better planning and implementation. And as part of the second recommendation, we also felt that the stateless nationality is an important issue for many countries. So perhaps we should also think of some incentivizing the frontline workers involved. And when it comes to the third recommendation, digitization, well, there's no disagreement that how much importance we need to give. Example was again drawn from India, saying that how birth registration can be linked to HMIs, which is the admin system of India, and the Aadhaar, which is the unique identification number, which is also used for all the social protection schemes, which is cash-based and directed through the beneficiary through bank transfers. Over from my side.
Thanks, Piyush. Bhaskar, do you want to hand it over to you for your group?
We had a small group, Anne and I did the most of the talking, So let me summarize. Overall, because silence is a sign of acceptance, so I'll say that all participants were in agreement for 3 recommendations, and we discussed about the final nuances and how these recommendations are going to help in terms of expanding the lens of CRVS in line with new legal identity approach, which talks about starting with a birth registration and then exiting with death registration, and the importance of having a very well standardized and well interconnected digital systems, especially with the health system, so the data from the health system can feed into CRVS. From CRVS, it can go to national ID, and keeping CRVS at the center of the overall ID ecosystem. So broadly, we had, these are the things that we discussed, unless Anne wants to add something. Over to you, Anne.
Thank you, Bhaskar. No, I think you've said it all. Silence is acceptance. So I think our recommendation for approach and a more holistic approach, and that's what we addressed as well.
Thanks,
Thanks,
Bhaskar. And so then let me pass it over now, because we are running really late. Pass it over to Beth just to wrap up and close. But I don't know if Kirsten and Bhaskar, you probably will want to get in touch with some of the participants, no, in the groups to get more detail. But over to you to do that. And then Beth, please, if you mind to do the wrap up.
Sure. Yes. Okay. Thank you. Thanks everyone for joining this session. And I believe that if there were any questions that were not addressed, I think that all of the presenters and the facilitators would certainly welcome any questions. So always happy to respond to those. Just to thank you all so much for joining this morning and for your very active engagement and participation. And we look forward to seeing the management response, which is created. And again, I mean, the intent of all of these evaluative exercises is aimed at program improvement. So, you know, we're really looking to make sure that UNICEF is at the top of its game in regards to strengthening civil and vital registration systems. So thank you all very much, and wishing you all a happy holiday, and have a great day now. Bye-bye.
Thanks.
Thank you.
Thank you.
Bye.
Goodbye.
Bye-bye.
Bye.